Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Next, umbilical cord remnants. In umbilical cord remnants, there are two tubular structures which are seen within the umbilical cord, that is allantoic duct and vitelline duct. Allantoic duct is also called as urachus, and allantoic duct or urachus is from the cloaca. Cloaca is a part which forms the bladder. This from the allantoic duct starts from cloaca and ends in the umbilical cord. It is normally involuted, or it is normally disappears at birth. But if it is not involuted, then there exists a direct connection between the umbilicus and the urinary bladder, and then you will see that the clear yellow fluid, which is nothing but the urine trickling out or coming out of umbilicus, if the urachus is still patent in a newborn. So that is one umbilical cord remnant, that is allantoic duct or urachus. Second, we have vitelline duct or omphalomysenteric duct. In vitelline duct or omphalomysenteric duct, it is a part of primitive midgut. It is a connection. This vitelline duct or omphalomysenteric duct is a connection from the ileum, which is a primitive midgut, to the yolk sac. Even this will disappear at birth. But if it is not involuted, or if it is not disappears, then the gastrointestinal contents will protrude out of the umbilicus.
thank you and thank you for watching.